Welcome back to part 5 of the Hashimoto's thyroiditis question. The question we asked was, what is Hashimoto's thyroiditis? But in this video, I want to go over what are the things that we can do to actually help the condition, okay? So if you're new here and you're new to this topic, you might want to go back and watch part 1 through 4, okay? Because I've went into a lot of details explaining how this disease comes about, how we diagnose it, how it's conventionally treated, some holistic options, but here are things that you can easily do on your own that might start to even help you if you have this condition. So again, just quick summary, Hashimoto's thyroiditis is a disease that happens when your immune system decides that your thyroid is an alien to your body, okay? What I mean by that is the immune system just decides to start making antibodies that attack the thyroid and causes a severe amount of inflammation that makes the thyroid not work properly. And it causes what we call a low functioning thyroid or hypothyroidism. Okay, so the name Hashimoto's comes from the name of the doctor that discovered this condition, but the disease really is a type of low functioning thyroid. So hopefully that makes sense. If not, definitely go back and watch the other videos that I've made in this series. So today we're going to be talking about what are things that you can do to help Hashimoto's thyroiditis. So the first thing I want to talk about is you have to really understand how to help the immune system if you want to help this condition. This is not just about taking thyroid medication. And I've seen a lot of patients that have been on thyroid medication for their Hashimoto's for years, and they still feel like crap. Like it's like, it's not doing anything. I wake up every morning an hour, take this medicine, wait an hour before I can eat or drink or do anything, but it's not doing anything for me, doc. Like, I don't even know why I take it. I've had patients even just stop. They're like, I don't feel any different. But what I want to talk about today are some natural vitamins that you can actually take that might help your autoimmune thyroid condition, okay? The first one I want to talk about is called selenium. So selenium is a trace mineral that we find in a lot of foods, but specifically the food that has the highest content is what we call Brazil nuts. And taking just 3 Brazil nuts a day can give you up to 50 micrograms of selenium. And that's about how much I would usually recommend for my patients to take to help reduce their thyroid antibody levels. And this has been shown to be actually effective. So now it's not going to treat the whole thing and make the whole disease go away because it's in conjunction with other nutrients, okay? So first we add selenium, okay? But even before we add selenium, right, what we want to do is make sure that we have a good gut, a GI tract that is able to absorb this nutrient, because you can throw as many things you want into the gut. If the gut is inflamed and it's not absorbing anything, it's a waste. So one of the first things, very first thing I should say, that I do for my patients is I tell them, look, we've got to heal the lining of the gut. At this point, your gut is leaky, okay? What I mean by that is the immune system, because it's been so inflamed, has damaged the lining. There's been damage in the lining of your gut that has caused the immune system to be so overactive. So we have to go in there, pour some nutrients in there that's going to heal the lining of the gut. So what do we use, for example, for that? Very commonly, we like to use L-glutamine. So L-glutamine is a simple amino acid that you find from eating good quality protein. But to heal the lining of the gut, we have to get about 3 grams or more. I mean, there's some supplements that have up to 5 grams, right? But minimum 3 grams of L-glutamine poured into your gut once or twice a day has been shown to help heal the lining of the gut. Get those cells that have been broken apart to kind of glue back together and protect your intestinal mucosa, okay? So adding L-glutamine to help start to heal the lining of the gut is very important. We also want to make sure there's no candida that's releasing cytokines and toxins into the gut to try to damage it. So we screen the patients to make sure they don't have candida problem. So we treat the candida problem, right? Using herbs or sometimes prescription to try to get the candida out of there, right? We want to make sure that gut has good beneficial bacteria. So this is where we recommend to patients taking prebiotic and probiotics. We make sure the patient has fiber in their diet to help bind toxins and get them out, right? Get the stool moving, help relieve that constipation, right? So we start to do that. Then we go into adding nutrients, right? That's when we want to add the selenium in, right? We want to add vitamin D, right? So I've talked about vitamin D, I feel like on almost every video in this channel because it is so versatile in what it does. And it is very, 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 very important for our immune function. So when the immune system has gone awry, 9 out of 10 times I find the vitamin D level is low when I check it. So even without looking at your level, I already suspect that there might be some vitamin D deficiency if you've been diagnosed with Hashimoto's. So we definitely want to take some vitamin D, but the trick with vitamin D is if you're not taking it with some vitamin K2 in it, it's not that great. It's not going to absorb very well, right? Because it's a fat-soluble vitamin, it likes to be absorbed with other fat-soluble vitamins, okay? So we want vitamin D that has K in it, so you buy it like that. There's a vitamin D plus K. That's what you want to get. Specifically the type of K, we want the MK7, okay? So remember, we want vitamin D. Most of my patients are needing somewhere around 5,000 units if they already have autoimmune disease. With this one, you have to check with your doctor because look, vitamin D, you can also take too much. So we want to make sure we're not overdoing it, but we want to make sure you have enough to help your immune system recover. Okay, what else do we do with vitamins to help Hashimoto's? We love B complex. Oh my goodness, B complex, that's an energy vitamin. Most patients with Hashimoto's, top on their list is fatigue. Why? Because when the thyroid is not working well, you're gonna be tired, right? So B vitamins, they're your energy vitamins, but they're also very good for detoxifying your body. In patients with Hashimoto's or other thyroid disease, they also have trouble losing weight. Guess what B12 is gonna help you do? Help encourage fat burn. Okay, why would you want that, right? It also helps the liver detox. It also helps with making red blood cells. It also helps with nerve pain. It just does a host of things. And it is one of those vitamins, because it's water soluble, that you cannot become really toxic on, right? So you just want to make sure you're taking B complex. One side note with B vitamins is that I usually like to recommend my patients look into using methylated B vitamins, which we call the active version of the B. The reason is a lot of patients don't absorb B vitamins very well. They take it and then there's no intrinsic factor protein in their stomach to absorb it, and then it goes down the drain. So by buying the activated version, sometimes that is a little bit more helpful. We still have to exercise caution here because we don't want to over-methylate, but at the same time, this is something where it's good to start, but you want to work with a doctor that can check your levels, make sure you're not overdoing it, and make sure that in some patients we even have where they have a condition we call the MTHFR gene mutation that requires that they should only be using a methylated B12. So there are other things that your doctor will be looking for and checking that needs you to go make that consultation and ask them to help you. Alright, so one other thing that I would recommend in patients with Hashimoto's, I usually tell them, hey, you gotta take some magnesium. Why? Magnesium is very helpful for a lot of detoxification in the body. It's good for those sore muscles that you're having. It's good for your liver in terms of detoxifying, in terms of like when we're talking about the thyroid converting from T4 to T3, we need magnesium as a cofactor. Okay, so magnesium, about 500 milligrams of that of the magnesium glycinate is a good one to take. Why? Because the glycinate version does not give you diarrhea like the citrate version, right? It doesn't cause those issues. It's mostly going to help relieve soreness in your muscles. It's going to help the spasms you're having in your body, and it's going to help you sleep well. It's going to help some of that constipation, but not in a way where you're having diarrhea. right? So that's the reason why I like the glycinate version. It's easily absorbed, doesn't give GI effect, like just any type of discomfort. So hopefully that makes sense. Now, what's the last thing I would do for a patient or recommend that they do? I would recommend that at least once a year, maybe twice a year, to do what we call a liver detox. And a lot of people get this all wrong. When I say liver detox, I don't mean any type of ash colonic or anything like that. What I mean is pour nutrients into the liver that allows the liver to move through its different phases of detoxification. So meaning, for example, if I put milk thistle, which is an herb that you can take, that allows the liver to actually detoxify a little bit easier. So something like that is what I'm referring to. And a lot of liver detox supplements or powders or vitamins actually contain some of these vitamins that I already talked about. So it could be just as simple as getting a liver detox powder that already contains a lot of these nutrients. That's one supplement that I carry in my practice that allows my patients to kind of get a lot of these nutrients all in one, and they just take a scoop of it, they add it to their morning regimen, or maybe their smoothie, maybe mix it into their oatmeal, into their juice, or whatever it is that they're having that day, and get their body functioning better. So hope this video has been helpful for you to at least know some things that you can start looking for to add to your supplement regimen that's going to help you with your Hashimoto's condition. Now, I have one other thing I want to talk about with Hashimoto's, and that is hormone imbalance. How does that affect Hashimoto's? Join me on the next one. I will be talking about that video there. I'll see you on the next one.